please, 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 please educate in general. He's Joe Smo from 5 years ago and you know his son. Like, no, they
I don't dance now, I make money move. Say I don't gotta dance, I make money move. If I see you now speak, that means I don't.
All right, girl, I'm on a roll. So if you see me with the same shirt on in the same spot, we pumping these videos out, okay? Hey, my name is T. I am a hygienist. I've been a hygienist for 8 years, and I love making videos to help you guys out if you're trying to become a hygienist, or just answer your questions and share my stories with you guys. So make sure you like, comment, and subscribe and support the channel. Also, share this with your friends and family, even if they don't watch it. If you share it, that helps me to get in the algorithm and make people think that it's a popping video for YouTube. You know what I'm saying? So let's get into what this video is about today. And yeah, so today I wanted to talk about understanding your responsibility as a dental hygienist within your state. We know what we're supposed to do, but do you actually know, if you're a hygienist, like what hygienists do? Or if you're a hygiene student and you're looking into getting into this career, do you know what hygienists actually do? So I'm going to answer that question for you. And I'm also going to answer if the state laws and statutes that we're allowed, what our scope of practice is. That's the word, scope of practice. So what that means is when you're practicing on a patient or you're practicing in certain areas of your state, what are you allowed to do legally as a clinician, as a dental hygienist? What are you allowed to do legally? Every state board of dentistry of every state has certain laws, and certain things can fly in one state that can't fly in another. So just make sure you know your scope of practice also. So if anyone, including dentists and including patients or managers, try to make you do something that is negligent or malpractice-y, yes, I just made that up, that you can go, that is not in my scope of practice. I cannot do that. Legally, in state Florida law, I am not allowed to do that. Or actually, yes, in the state of blah, 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 I am allowed to do that. So yes, I can. You need to educate yourself on the laws because they change pretty often. And also make sure, I'm always going to promote it, but also make sure you're a member, even if you're a student, of the American Dental Hygiene Association, and also look and see if your state has a dental hygiene association as well. Okay, so let's get into Florida. You can go look up your state that you plan on being licensed in, but I'm going to use Florida as an example today. So 2022, Florida has updated their dental hygiene scope of practice laws and policies. This is a lot to go over. And there are like legal terms within here, so I'm not going to read everything. I'm just going to go over a few things, so if you're reading this for your state and you're confused, at least you have something to go based off of. A dental hygienist is otherwise understood as the clinician who is able to create the task of removing calculus deposits, which is hard plaque of the teeth in dental cavity, accretions, which is also like plaque as well. You'll learn more about that in hygiene school if you're not already in hygiene school. There's a difference between hard plaque, soft plaque, saliva, blood, pus, etc. Those are all different things. And removing stains from exposed surfaces of the teeth and from the gingival sulcus, the gum line. If you don't know what that means, the gum line. And the task of performing root planing and curettage. So root planing is scaling and root planing, which is going further beneath the gum line and scaling the root, which is what we do all day, what we should be able to do, which is removing calculus, inflammation, bacteria with our instruments, and cleansing around the gingival area, the gum area, and the root surface, cleaning the root surface of the tooth and actually getting everything healthier and trying to treat and prevent periodontal disease, gum disease. Okay, so that is our job. And curettage is the actual like, I don't want to say cutting because it's not cutting, but kind of like scaling or just slight nicking of the gum to get it off, if that makes sense. So yeah, I know I'm a little rough right now. I'm trying to just go over this without sounding like a crazy big word book, okay? So bear with me. This video so far, make sure you give it a thumbs up because I'm struggling right now. It says dental hygienists may expose dental x-ray films. We know that. Apply topical preventative prophylactic agents. So like applying topical fluoride, doing sealants, and performing all tests by dentists in ordinance with this law. So it has a number. It says 466024. So they do have a link you can click on that number and it will take you to another page where you can read about it. It's some legal terms in there that I don't really want to get into, but if you need to, you can go on there and just go line by line and read about it. When we had public health in dental hygiene school, our last semester in my school, you had to know that law. I don't remember it by heart, but again, dental hygiene school will teach you some of this, but I wanted to refresh your mind and just prepare you if you're in hygiene school that you're gonna have to know about this, because some of it is on your board exam as well. Okay, called with the board of dentistry is called direct vision, indirect vision, and general why can't I speak? Direct, indirect, and general supervision of the dentist. So that means that the dentist has to be directly in your face for you to do that. The dentist has to be somewhere in the building, and then the dentist can just tell you over the phone, hey, yes, you can do that. I don't need to be sitting in a room. We all know that your license and my license is hanging up and I gave you permission to do such, okay? Making sense and it's not confusing you, okay? Let me know in the comments. So, dental hygienists may perform their duties in the office of a licensed dentist, in a public health program and institutions of departments of children and families. They can be in Department of Health, so like community health centers. They can be in schools. It just depends on the state, obviously. Department of Juvenile Justice, which is basically a baby jail or a federal facility. We are practicing in federal facilities, yes. There are dental hygienists in jail. Yes, inmates get their teeth cleaned. In a health access setting, which can just be like a mobile dental van or something like that. Remember in school you used to have like a health van that used to come like once a year and come and do like a health fair? I remember that. I think that's what made me want to be a hygienist. Like, I liked getting my teeth cleaned and brushing and learning about it and all of that. And then they go on to go about where you can work, where hygienists are able to work. None of these say a house, unless the home of a non-ambulatory patient, but also even then you have to go by the laws, okay? However, the dentist issuing such prescription shall remain responsible for the care of such patient. So you're working on this patient supposedly, but the dentist still has to supervise you in some kind of way. You still have to be in contact with the dentist, even if it's via phone, email, something. They still have to be responsible and supervise you and the care of the patient. You are not a doctor. You're just another health professional, okay? The doctor and the law have the last say about everything. So, you're basically working under the dentist license too, because if anything goes wrong, it's on him. It's on you too. Like, malpractice can be on you, but it's on them too. Yeah, a patient of record means a patient upon whom a dentist has a complete medical history, completed a clinical exam, recorded any pathological conditions, and prepared a treatment plan. That's a patient of record. I want to talk about this because there's times when I work at offices where a patient hasn't had an exam in like 5 years and they come back and they just want to get a cleaning. And it's like, some offices I've been to that I do not go back to because I have had to argue professionally with a dentist or a front desk or manager about the fact that we cannot just jump back into somebody's mouth just because he's Joe Smo from 5 years ago and you know his son. Like, no, they have to have what the law said, an exam. They have to also have x-rays done. They have like certain things that need to be done to complete the exam. So if you don't feel comfortable during certain things, always know your laws and pull up your laws so you can professionally, you know, debate. Dentists may, without supervision in the state of Florida, provide education programs, faculty or training programs, authorize fluoride rinse programs, apply fluoride, instruct a patient in oral hygiene care, so teaching them brushing, flossing, rinsing, how to take care of their oral health, hygiene, supervise the oral hygiene care of a patient, and perform other services that do not involve diagnosis or treatment of dental conditions and that are approved by the rules of boards. I think this is funny because we're allowed to say, yes, we think this patient has 5, 6, 7, 8 millimeter pockets, 4 millimeter pockets. They have bleeding profusely. There's inflammation. There's calculus built up. Their medical history also associates with this. I think, and I see signs of periodontal disease. They need a scaling and root planing. They need a deeper cleaning. This is what's going on. Blah, blah, blah. We cannot diagnose. So the dentist can still come in, look at all of that, which to me is negligent, and say, that's a prophy. Don't even worry about it. Like, everybody has gingivitis. He don't floss. We know. It's okay. Like, we can't diagnose anything. The dentist, at the end of the day, has the last say. And I love when dentists give me the autonomy to say what I think is good for the patient and to have a total community conversation with the patient and decide what's the best treatment for them that is most reasonable for their care without neglecting them and without like borderline neglect. Like, it's just crazy how we're not allowed to do certain things, but it's our responsibility. Like, I don't get it. So yeah, you're gonna run into that too. Okay, I'm almost done with this page. If I'm boring you, I'm sorry, but this was more of like one of those like to the T type of videos. But if you're still with me, we here. I see you. We here. All right, almost done with this. The board by rule may limit the number of dental hygienists or assistants to be supervised by a dentist if they perform expanded duties requiring direct or indirect supervision to the precision of this chapter. The purpose of the limitation shall be protect the health and safety of patients, to ensure that procedures which require more than general supervision are being adequately supervised. So that means you could have one dentist and he has 8 assistants and 4 hygienists, which is insane. I have never seen that, but like, right? And he's the only one practicing, or she's the only one practicing. If the Board of Florida State Dentistry goes and sees that there is so much going on and it's not being handled in a proper, correct, healthy way for the patients, they could say, you know, pack it up. You only need 3 hygienists and 2 assistants, period. You know, so that's a good thing. That's my interpretation from that sentence. It says, however, the Department of Children and Families, which is basically like, you know, ACS or CPS, you know, Department of Health, Department of Juvenile Justice, and public institutions approved by the board shall not be so limited as the number of dental hygienists or assistants working under the supervision of a licensed dentist. So I'm guessing the need versus the want is necessary. Like, if we have 1 dentist but we have 8 hygienists and 8 assistants, that's okay, because we're trying to handle like public service and everything that's going on within jails and child care communities. That's what I think they're saying. So they like, when it comes to that, it's okay, because we're trying to get as many people from the public situated. Got 5, 6, and 7. 3 sentences left. You got this. We almost done. Dentists may, without supervision, perform dental charting as performed in 46 point. Dental hygienists are exempt from the provisions of Part 4 of Chapter 468. A dental hygienist may administer local anesthesia as provided in 46.017. So, this is just a basic start of Florida statutes for a dental hygienist. I highly suggest that you go and see what your state says is okay for you to do in your state. Please, 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 please educate yourself on what you're allowed to do and what you're not allowed to do in each state that you're going to be licensed in, because these dentists and these managers and these front desk and these other hygienists will try to play you. They will try to play you, and your license will be on the line if something happens and you're doing something with a patient that you're not supposed to be doing. Okay? And if you feel like you're doing anything that is not making you feel comfortable, speak to your labor laws office in your state. Speak to legal action in your state. Bring it up to the State Board of Dentistry. Report that person who is making you feel uncomfortable in any kind of way, and report them anonymously and make a complaint. And if you can, find another job and get up out of there, because trust me, your license and your hard work to become a hygienist is not worth anyone throwing it all away over something foolish. Okay, so I hope this video was kind of helpful for you and gave you some perspective on what the dental hygienist does. We do a lot more than just cleaning teeth. We are teeth superheroes. We are people. We are not only clinicians, we're educators as well. So yeah, I hope you guys are enjoying my little series I have right now going on. I'm on a roll. I am on a roll. Let me know what else you want to see in the comments. I will make videos based on your requests as well. And like I said, if you want to see any more videos from me, make sure you like, comment, and subscribe. Don't forget to check out the description box. I will leave more information and more links in the description box. And yeah, I hope you enjoyed this video, and I'll see you next video. Bye. Have a good week. Bye.